Beautiful. So I'm just going to introduce myself. I know a lot of folks who are on the call, but I will just give you the, general spiel. My name is Kat Atkinson. I use she, her pronouns. I am Voices for Virginia's Children Youth Mental Health Policy Analyst. So my age group is 0 to 26. Just really excited to be able to convene some folks from the schools. I have been working closely on school-based mental health services and really getting to understand some of the nitty-gritty of what school-based mental health looks like in Virginia and how it looks nationally and how we can just really support our young people through the school system. And I've learned a lot from these folks here and just was really excited when we were able to bring them in to have a conversation just about what's going on and what they're seeing on the ground. We're really grateful that Anthem Health Keepers is sponsoring this webinar series and just want to give them a shout out for being willing to support us in this work on the ground and in policy. And so just really excited to be able to bring these voices here. So a little bit of background, Voices, we wrote a report called Toward Wellness, looking at school-based mental health initiatives across the state of Virginia and just really starting to get that groundwork about what is going on. And this is ever evolving, so this was just kind of a part one to like a larger conversation, which is why we thought maybe we should create this webinar series, bring people together, hear from folks who are experiencing it, staff, young people, such stuff like that. So we're really excited to be able to uplift this work, and we're still learning and we're still growing. And so just really grateful to be able to convene folks to continue that conversation. So let's go ahead and get started. Can we do a round of introductions? So we want to hear from our panelists about what school they come from, their role, any important identifiers for folks to know, and then we'll go from there. So let's go ahead and start with Angela. You're the first person that I see right now.
All right. Thank you so much, Kat and Voices, for lifting up this work. I'm so excited to see that because I am not in the same age group you introduced yourself in, and have committed my life to this. So I am Angela Jones. I am the Director of Culture, Climate, and Student Services in Richmond City Public Schools. I entered this division as a psychologist, so mental health is very near and dear to my heart. And I am just excited to help propel this work. I am in many ways sorry that we must, but excited that we can. And so I am very grateful that to join this conversation with these other folks on this panel. So
thank you. I love that. Tawana.
Hello, my name is Tawana Fortune. I am the Supervisor of Student Support in the Office of Student Conduct and Support of Chesapeake Public Schools. I know a couple of people that's panelists, a couple of people that are guests, so I'm just excited that you all are here. One of the mantras that I sort of kind of live with, I was trained under Dewey Cornell for threat assessments. And he often said, if you think the price of prevention is costly, try restoration. Right. So I think that the work that we do, I'm hoping that it is a preventative nature, that we're all trying to move beyond just reacting, but now we're in preventive mode to make sure that we are meeting our children's and students' needs. Thank you.
Thanks, Tawana. And Jay.
Good afternoon, Jay McLean. I serve as Deputy Superintendent for Hopewell City Public Schools. Part of the areas that I help coordinate for our division are everything from student services to security and a variety of other areas, see how they are intertwined, see where the funding goes and doesn't go as much, and certainly have a heart for making sure we're doing the best for our kids.
Awesome. Thank you all so much. I think similarly to what Angela was saying, I feel, sad that we must, and just really excited that there's an opportunity and more conversation is happening. So really just grateful for y'all to be here. So the first question I have for you is, talk to me a little bit about your current mental health services, supports, programming, what's going on in your school divisions for mental health for students. And, I know that there's been some changes over the last year or so, but just kind of see where we are now and get kind of a baseline about what's going on. So I'm not sure, we can just kind of bounce around however you feel, if you feel inclined.
Well, I can get started. I'll take the plunge, right? So I will say to you that we have a school safety task force, and out of that school safety task force, a mental health and wellness subcommittee was born. This actually happened after the unfortunate tragedy of Marjorie Stoneman. And our school safety task force has everyone from all entities, from our police department, fire department, Commonwealth Attorney's Office. We just have all models, if you will. So the school safety task force was born, and then the mental health and wellness subcommittee was born. So from that, we have external stakeholders and internal stakeholders, and we are trying to meet the needs of our students. Some of the major things that we're working on from last year to this year is to make sure that we have our MOUs that are set between our schools and our outer agencies. We're looking at like our behavioral health, CHKD, our KIMS field. So those institutions that can move through hospitalization and perhaps on-site or off-site counseling strategies. But we're also moving towards some different directions. Like we're working now on an MOU to use therapeutic dogs during crisis events, in the event that we have unfortunate situations where we may lose a student and or a teacher, that we're in a space that we can create mental wellness for kids, because as we know, therapeutic dogs seems to help move that process when they're grieving. We're also looking at increasing our website, our Office of Student Conduct and Wellness website, to incorporate the mental health agencies that are needed for parents, that perhaps things happen with their students after school hours, right? So then they can move to a space where they can automatically connect for mental health resources. Our office was also awarded a $250,000 grant from DCJS, and what we're doing is expanding our behavioral threat assessment teams, where we're having behavioral threat assessment case managers. One would be the person who is actually moving through the process of having these meetings like twice a month, just like a child study or 504 meeting. And then we have the other case manager that's doing the handwork, all of the database. We're also incorporating our school social workers who will be doing school-based mental health for those students who have moderate threats. Those that have high threats come through our office, and they get monitoring through our student engagement resource counselors. But we also provide that for our students for expulsions and long-term suspension. So what we're doing now is moving through a more proactive approach. Even our ISS coordinators have been trained with responsive classrooms, and now we have them doing more of a restorative approach with learning how to do replacement behaviors. So our movement in mental health is starting more on the SEL framework, and we're moving towards the mental health framework. We have our city is very parent focused and very parent involved. So we're making slow steps before we start moving into what our desire will be the true mental health services in our school systems. And we're moving towards that goal. So that sort of kind of starts us out for Chesapeake.
Fabulous. Thank you so much for sharing. I really am excited that we're, thinking about the therapeutic dog piece. Young people, love their pets. That's like a very innovative way to bring in some mental wellness. And it just seems like you're doing a lot of amazing work on that restorative piece. So thanks.
So I can jump in next and try not to repeat a lot of what Tawana said. I think we are in the city of Richmond. We are, I always refer to the COVID time or post-COVID time as the silver lining, because it literally gave us some funds to really move some work we've all kind of thought about or dreamed about or had wished for along the way. We have our city has a trauma-informed leadership team that includes our mental health partners, as well as all of our major mental health staff leads of our staff in the division. And we really are operating on a MTSS, multi-tiered systems of support framework, much like Tawana referenced. The SEL work is really propelling our conversations around this. I will say that I do try to really set the foundation that when we talk about mental wellness and mental health, we are not just talking about clinically challenged people, but we are really trying to start from the putting our toes in the water and promoting mental wellness in the same way that we promote good health and good diets. You know, if we're we just want to eat your fruits and vegetables, we want to do good things that just set our minds in good places. We do know that that children come how they are, and they bring their families with them, and they are carrying heavy burdens, and so sometimes our start is not quite where we want it to be. So we are really working on making sure that we're creating that it's everybody's job, not just the psychologist's jobs, but everybody's job to help us create safe, trusting environments where people want to engage. And then beyond that, we are trying to make sure that we are building those classroom level restorative trauma responsive places, right? Really intentionally working on building communities where children do feel safe and sheltered and fed spiritually, emotionally, as well as the food, as you do in an educational place. But we're starting every day in our K-8 environment with those basic community building circles. And, what we've discovered is we are really having to reteach adults how to build relationships with children. And once I got over that hurdle of understanding that, I really embraced it, and we really went in full with that, and to help grow our adults and children in a good space. But beyond that, we have really doubled down in the last 2 years, and particularly in our counseling front. Elementary and middle school counselors, we're really trying to make sure our schools are adhering to that 80% of their time in direct student service, which has been maybe a bigger challenge than I had anticipated, because people I've found have defined direct student service in a variety of ways. And so we are really trying to help define that for the division and what that really means, and intentionally building strong social and emotional skills in our children, and really working on those 5 core values. And then moving up to that top tier of supports, and I'm probably moving quickly, but because there's so much work being done, but we have really developed super strong partner relationships, particularly with our community services board and Child Savers, which is another agency, and they're in 15 of our schools. But I cannot shout out enough our community services board, RBHA. They have just met us in every place possible, and literally, if they have the resource, they give it. Or they find out a way to do it. And what I really appreciate with them is the ability to serve families. We know that we don't just need well children and well classrooms and well schools. We need well communities. That means families feeling well as well. So they meet our families in our schools. We have all of the trust issues and all of the cultural barriers and stigmas that are associated with mental health, and just meeting our families where they are makes a tremendous difference. And for many of our families, that's in the school. And so we have clinicians embedded in our schools so that children who are demonstrating the most serious needs can access their services early and often and easily. And so that we have a lot of work to do to grow that area, but I'm very excited about the work that we have done to help connect families to direct, true clinical services for where those services are needed, and teachers to be able to kind of pull on those strings to help with that. We may talk about it later, but one of the things that we really had to shift when we started bringing clinicians in was we aren't just hanging a shingle outside a door for someone to have outpatient counseling, but truly embedding that mental health work into all fabrics of the school environment that are permissible. So I think I'll stop there, but lots to say about that work.
Oh my gosh, so amazing. Just like so many great things that are happening in all of your schools. Obviously, I've been talking to you all for a little while, but just really appreciate the intentionality to those like lower tiers too, and really getting that that is the foundation. That is those first steps, the real start to the prevention work that gets us to the higher levels. So just love hearing about that. Jay?
Yeah, I'll echo a few things my colleague said. I would say we are a lot smaller division, but certainly experience a large percentage of our students that have significant needs. I'd say to echo one of the pieces around COVID times is I do think COVID amplified the awareness of some of the mental health needs. It obviously provided more of the funding for a little while too, but it also made it, I don't know if you'd call it a safer space, but a more permissible space to start talking about those things a lot, and not wanting to lose the opportunity to continue the work as the time and distance from COVID passes a little bit. I'd say we also work on some of the same kind of foundational tier one pieces in some ways. I would, just to add to some of the things already named without repeating them, just basic surveys of how students are experiencing their environment, and being able to continue to look at that and use that. I also think looking at the role of cell phones and trying to, because that can become one of our real challenges, that how it, again, I think of it almost as an amplifier of sometimes the things that aren't good. It can be used for good, but so often it's not, and it creates a lot of challenges for our students. And so looking at ways we can get at that. But I would say the biggest thing that's happened for us in the last couple of years is our partnership for the more intense services. So similar to Richmond, we use Child Savers, and we now have Child Savers specialists in each of our schools. So being a division of a little under 4,000 students, that has helped us a lot to make sure every site has that. Even with that, obviously, we've got waiting lists, and prioritization that has to happen. But they've really been able to make a real inroad, and they're really accepted by our families and seen, built sort of that trust. There's so often we are worried when we go to families saying, here's something you can opt into, and if they're going to feel okay going forward. And I do feel like, for us, Child Savers, it's built that relationship where we have families saying yes to that when before they may not have as readily for other things. So a lot of the other things that folks have mentioned, but I'd say those are the things just to add on it for Hopewell.
That's incredible. Yeah, we love Child Savers. We do a lot of work with Child Savers individually too, and they're just like rock stars going into all these schools and doing such amazing work. I am gonna go like slightly off the questions that we had prepared, because I'm interested in knowing more about how we can support staff, because I think that, like Angela was saying, it's all adults in the schools are a part of this. And I think that it's really important that they are well, but also supported. And so I'm just curious, one, like how staff have received mental health, like as like more of like a newer idea of something that's priority. And also in what ways could they maybe be better supported through state policy and things that we could change on our end?
So I can speak to that. So we'll have our new, what we call NEO, new employee orientation, and I conduct NEO for our EAP, Employee Assistance Program. We have a wonderful employee assistance program that really dwells down into the needs for mental health assistance. So it really unpacks, what you have as far as any diagnoses or perhaps those that have not been diagnosed. But the great thing about our healthcare system is that it provides that type of care not only for the person who works in our division, but also for those in their family unit. So you could have your own, marital issues that you need to deal with, or you may have your own children that you need to deal with. But also our EAP deals with, like financial means or identity theft, some of those things that we just don't think that could impact our mental health, but it really does. Some additional factors that we have is that we have our own pharmacy, which somewhat impacts how much our copays are within our school division. So that really works really well. But we also have our own behavioral and mental health counselors for our own staff. So you can, move through that process. If you use our medical facilities, you don't have to take your time off. And we have that pharmacy with the lower copay. So sometimes we think about the mental health, but there are other pieces of that, like let's say identity theft or the financial planning, or perhaps you're looking for care as a caregiver yourself for someone, for respite for yourself because you're caring for parents. So our EAP process really, really helps support our staff. Another thing that I think that supports our staff too is that, VDOE has the Cultural Competency Standard 6, which means that teachers need to be trained within those units to understand different cultures. The more footing that we can get in understanding who our students are and what I call the cultural capital that they bring to our classrooms, the more it helps us embed differences. And sometimes I think that impacts our mental health as well. When we feel like we don't understand kids, the more that we know who they are, the more that we can interact well. So I think our EAP and also the medical provisions that we provide in Chesapeake Public Schools really gives our staff a footing in the right direction for mental health wellness.
And that cultural capital and cultural competency piece really helps, young people in schools feel like they belong to. And that is another part of that like prevention piece and making sure that belonging really impacts how young people feel when they're, in their classroom.
So Jay, were you getting ready to talk? I'm sorry. Do you want to go?
I'll be quick and then I'll let you go, Angela, because I think you may have more to share on this one. I think this is an area that we're still much more growing on and trying to figure out the best solutions. I'll say we do have in our one high school, we do have a community partner with Community Health Clinic, and that provides some of that support, as was mentioned for Chesapeake. We've had, excuse me, had some initial conversations about trying to leverage support of like Child Savers with our staff also and tying into EAP. And that's something really more a work in progress for us. It's definitely seen as something as a need. It's not something we focused on as much as the student mental health as of yet. That's not because it's not important, but that's where we are right now.
Thank you, Jay. So Kat, I want to start with the first piece, the last part of what you asked. We need money. And we need dedicated funds that call out staff as the only recipients to this fund, to these funds. And I say that because once again, that silver lining of COVID, the downside obviously was that we had more staff presenting or was like the rest of the world with some of the issues. And we were able to channel some of those funds to do, hey, every school got a certain amount of money to create a wellness space. We had a trauma-informed, trauma-responsive clinician who we brought on staff who actually helped actualize each of those rooms, to what staff needed. So whether it was a massage chair or whatever those things were, I mean, money didn't go terribly far, but we kind of introduced it as a volunteer thing by each school and then got a little more strategically forceful to kind of say, this is what we want to do for staff. In addition to that, we have done things like the expectation is that staff meetings are started with the same kind of circles we're expecting with children. We haven't gotten as far with that. That's a harder one to keep going because, life starts happening and people get busy. Couple of other things is that we also utilize EAP. It's been phenomenal for some people, not so great for others. So we've got some mixed messaging in our community with regard to that. But we did actually invest, the division invested in crisis counselors beyond the normal crisis level for EAP because we are a division. Sadly, I think, Hopewell, you're there too. You have a lot of crises, right? And you're constantly calling in crises teams. And we got to the point that our school psychologists, counselors could not keep up with children and staff at the same time who needed the supports. And so we did invest in, we now can send out crisis counselors to be on standby for staff while the school staff and division staff are really handling children with regard to that kind of need. Sadly, I mean, it's not like it wasn't in the news. We experienced a couple of horrible tragedies last year or year before with regard to like the graduation shooting, and we'd had a shooting at a school. And we did actually, through COVID monies, we were able to invest in a private agency to provide counseling that did not take a hit on your EAP 5 visits or your health insurance. Literally, they came in to do some growth stuff, some group stuff with group growth things with the staff, as well as doing some individual things. And again, people were appreciative of that. And I think, but we don't have the funding to continue it. I'm actually concerned at this stage of the game because we're not completely out of it. And we have staff who are still in need, but so I am concerned without the funding to support that.
Can I circle back to that for a second, Kat? I think there's a policy piece here that's important too about the idea of what was said about targeting or earmarking funding for a particular purpose, that when that is necessary and is important, but in the decisions that have to get made at school board level and things like that, sometimes it will move that somewhere else if it's not protected. And if we know that mental health for staff is important, if it's not protected, though, and you've got a choice between students and staff, it almost always is going to go to students. The General Assembly will earmark funding that's for salaries for teachers, but there's not any other place I know of that there's anything earmarked for staff other than salaries, and maybe some funding that actually goes to supporting mental health there is something that's needed so it doesn't get washed into something else.
Yeah, absolutely. No, I think that is so important. I think that there's that is a part of prevention too, because if we don't have any of these staff, we can't do any of the work. If folks are leaving, they aren't well. So I appreciate that very specific example, because I think that what I have heard and what I have seen and experienced, and I have friends who are teachers, that this is a real need that's coming up. And yes, we still need to prioritize our young people. That is absolutely a part of it. We can't prioritize them if we don't have people who can support them at the same time. So it's kind of a concurrent issue, but still needs to be at the forefront of our minds. I think we're kind of touching into this next piece, which is, what are some of the challenges that you've been facing in meeting student mental health needs? I think we've heard a little bit more about our staff, but what are some of the challenges coming up? I think that it's easy to say funding. I think that's a big one across the board, but just wondering if there's other things that come up for you when we're thinking about challenges that you and your specific divisions are facing to really meet those needs.
So I can get started on that one. I think, and perhaps all of our divisions are seeing, is students that are self-medicating because they have probably issues that have not been diagnosed yet, and they think that vaping is the answer, or perhaps use of any other types of drugs. But I think that our number in the Office of Student Conduct and Support have risen, right? Over the years, we can really look at the data and see that there is impact of use of kids just going to other means of what they think is soothing, whatever it is that they have going on within their mental health or behavioral health, either one. So I think that is one of the challenges now. And I was on a subcommittee, and one of our tasks was just to count how many vaping stores are within a 5-mile radius of a school. And it's tremendous. I mean, your numbers can go from 25 to 50 within a 5-mile radius. So that market has really taken off, and they are doing a great job of trying to entice young folk to use that, right? But kids are not, we don't even really know the medical impact of what vaping is going to do years from now. So I think going back to the restorative piece is trying to help our kids to understand that there are other ways that we can deal with stress, anxiety, depression, than moving towards drugs, vaping, marijuana, things of that nature.
I know you said that funding is a obvious one, but I guess it is worth just unpacking that a little bit, in the sense of COVID, or I should say CARES, gave us a boost that was really unusual, and it enabled us to do some things that I'm really sort of worried as we move forward, like what's going to fill that gap. Even some of the funding that's out there is not really as reliable going into the future. What the CARES money did, not only was it a substantial amount of money, it also, you knew that it was there for a while. And it's so rare that we know that money is there for an extended period of time, so that you can make better decisions with long-term planning and not just try to do something in the moment immediately. I've raised this one before, but I think it's worth noting. There's also the times we have choices in how funding is limited or not limited. And as somebody who also works on the security side of things, was just really disappointed when we had the grant money about a year ago with Building Stronger Communities that was at the federal level allowable to be used for mental health, but at the state level limited so that it could not be used for mental health. And so that's one of the things where, it's about creating funding avenues, but it's also about how we don't restrict funding that potentially could be used for mental health. Because without those, a lot of these other conversations almost become a moot point in a community like we have, where we have significant financial issues at our city level.
Thank you for bringing up that funding piece, because I learned about the Safer Communities funding and how it had trickled down to the state and going into school hardening rather than like with those actual real restorative work that can get at not ever having to get to a place where we're hardening our schools. We're really trying to create a soft place and a healing place for our young people. And if anyone wants more information on that, I'm happy to provide that separately. But I definitely agree on the piece of not restricting, and also having flexibility in funding is really important too. But I'll just pause there, just uplifting that more.
Yeah, and if I can add one more thing, and I'll quiet on that one. I mean, we get funding every year that we know is coming for school security equipment. There's a school security equipment grant every year. And yet there isn't necessarily that same on the other side of the equation for mental health. There isn't something like that. I don't know if there's a way that, at least if we're talking hardening, there's the other side of it that goes in tandem. But it's certainly two different stories on each side of that.
I would just, you can't echo funding enough, but the other reality though is if you dropped, whatever it was, $10 million in my lap right now, there's not enough clinicians out there to hire to fill these positions. And so I think we have to look at what the workforce looks like. So I think that is a tremendous barrier for us, at least in our community right now. Even down at those that like non-clinical, but like school counseling, school psychologists, like we're still struggling. We hire student support, like just to deal with community violence and bullying prevention and restorative work. And it's tough to fill those positions with those skill sets. So I would highlight that. And then just beyond everything that, I would echo everything that Tawana and Jay have said, but I would also add like just some, I don't know if it's the lower level logistical kind of things, but still dealing with the cultural stigmas around what mental health supports look like. Dealing with teachers who feel like I can't send Angela out to get her intervention. I can send her out to get reading intervention, but I've got to get my SOLs up. I can't send her out to do mental health. And just trying to tamp that down and really help people understand that, and feeling like, and I know you all said VDOE is on this call, so I'll be careful, but feeling like I have to answer to VDOE if I don't get my scores up, when kids are just melting in their seats. And so I think it's some of those just kind of changing our cultural norms around this that is also a challenge and a barrier for us.
Yeah, I remember, I think that you told me I think about this often when you talked about how some of our students might be spending the night in their bathtubs because of violence that's happening in their communities, and they're supposed to be coming into school and be able to focus on their grades and like paying attention. And I think we've done a lot of amazing work to really center trauma-informed care as much as we can tangibly, but the realities of just like the high level of need to what do we prioritize in the school system, who is supposed to be prioritizing it or not, is still a question, and still something that I think we're figuring out as we go through this really difficult time with the mental health crisis as it is. And when you shared that with me, I think about that almost every time I talk about this work, where I'm like, okay, how do we get everyone aligned to at least change that culture and get those pieces where we're all on the same page that like, this is where they're going to be spending time, and this could benefit all of us if we can get young people well enough. It's going to improve academic success. It's going to improve all these other things. We just have to, there's some still work to figure out what that's going to look like. I really appreciate all of these pieces that we could think about from y'all's experiences. So I think just looking at time, I want to create a lot of time for this question. I love a magic wand question. It's like, if I could wave a magic wand and everything would be better, what would it look like? What would you need? What do you want? Like, I know the workforce is a huge piece to this. And that is something that I think about every day when I'm talking about this work, because I know that that shrouds everything. It's like, we need people here. We need people in the space doing the work, and recognizing that that is a multifaceted solution with lots of different organizations involved. But if we could wave a magic wand and you would have everything you need, young people would be well, teachers would be well, I don't know, what would it look like? What would you need? What would you want? Just dream big. And I just would love to hear what that could be for you in your school divisions. And I know that's a lot.
Yeah, that cat, that's like that's bigger than a magic wand. That's like fairy dust that's just thrown and just goes through your whole HVAC system in your building so that everybody has impact, right? So one of the great things, like I've just been taking copious notes, just like within listening to what my colleagues have talked about, just the things that like the trauma-informed leadership. It's like you get these ideas. And so part of what I think is that sometimes we as school divisions work in silos and we don't share the greatness that we have so that people aren't, formulating wheels that are already turning. So I would love that we could keep this going, just even if it's just consulting one another. But of course, the bigger picture would be how can we get direct mental health assistance in our buildings for our students, where there is a level of consistency, and the funding word has come up, right? The F word has come up in every occasion. So again, getting all from school boards to superintendents to city councils to understand how the impact of mental health will drive the community, drive the financial status of your community, drive your prison systems. So I think it is an all call. It's just an all call meeting that needs to happen. And I think we have different entities that do that, but when do we bring the meeting of the minds together to say this is it, this is the time? Because what are we really waiting for? Like we said, we're post-COVID now 4 years, and we don't want to have to go through another COVID moment. But mental health for our kids it should be a demand. It should be just like a SOL. It should just be a part of our everyday means of work, because if we don't have mentally healthy kids, they're not able to learn and sit still in the classroom to accrue new knowledge. So I will put my dollar on mental health every day.
I guess I would echo what you said, Tawana. I was just when you started the question, Kat, that is actually, even though you kind of gave me the tease that this was going to be a question, it's still bigger than I can put my head around, right? But I do think it actually isn't answered in the school, right? It is truly that utopia of collective community impact. That's going to make the difference, especially in, I can't speak for other people's division, but our division is, regardless of what the city looks like, where we are truly educating children who are coming mostly from poverty, mostly children of color, mostly to the children who are impacted by our social services, positive or negative. They're impacted by our housing authority, positive or negative. The community violence is just completely and totally out of control. We've just had how do we get parents back on board with us? How do we gain trust in systems that trust each other, let alone the community that trusts them? Like the conversation, and how do we maximize our dollar, right? So yes, the F word has been dropped a whole lot, but there is a lot of F out there. And I'm just not sure where it's all landing all of the time. And then to have those truly, truly collective conversations that move to action, versus competition. I don't know how that happens. Like that fairy dust, that is a tornado of dust that has to fall down, I think, to make those conversations happen. Because I think it's a seamless connection from the community out the door, back to the schools, back to, back and forth. And I don't know what that Candyland looks like. So.
I think one way that that I'd answer this is actually kind of simple, as a way to just make it manageable with the size of that question. And it's that we would approach mental health the same way we currently approach literacy. So if you take the current State Literacy Act, there's training that every teacher is to receive. There is funding for resources that are supposed to happen for all the schools. There's a way to assess how we're doing so that we are able to kind of see progress that's being made. There's shared science of what are best researched approaches for things. So in one way, your question sounds huge. In another way, it's like we already do it in other areas, or do it in a way that can really make a lot of inroads towards progress, but we don't consider it at the same level as kind of the 3 R's as a basic. And yet I think we've grown to appreciate and understand that mental health is at least as important as those basics.
Y'all are preaching. I understand that is a big question with I think it can be really hard to imagine outside of kind of the situation that we're in, but I think that you each brought, I think we can look systems wide at like this community utopia and really focusing on how we build collective community and build back trust within systems and build those spaces together. And then we can look at that. How do we really see things in a new way? And that literacy piece where mental health is just, I mean, it's always there. It's always present, whether we talk about it or not. We're all experiencing mental health or unhealth or disease at all times. That's always happening. And then it's the coming together, the interpersonal, the working together piece that just is really what needs to happen. And it's also, how do we get there? I also am trying to figure that out too. And so I think that it is moments like this where we have all these folks convene together, where this is where it starts. This is where we can begin some of these conversations. And just really grateful for your perspectives on this. I'm going to give you each like another minute or two if there's anything else you want to share about your school divisions, about school-based mental health, and then we're going to take some questions. Not sure if you want to just uplift anything or share. But I'll just give you another minute to share if you would like.
I'll start. I am appreciative that VDOE is setting up that new department with the mental health and wellness piece that would give us some direction so that there's a level of consistency across the state. As you know, we're in what I would call the 7 cities, right down in Hampton Roads, and we have kids that just jump from one school division to the next. And I am sure when I was in Richmond Public Schools, the same thing happened between the counties there. So with VDOE giving us that framework, if you will, that pedagogy of theory and practice, that would help us to be consistent across the state. A couple of weeks ago, we had people from my office went to Camp Wellness, and I really enjoyed. They had a whole series and have a continuation on self-regulation. Because as we know, that is a really big issue with our students in the school division. So giving some props to VDOE for the trainings that you all are providing. And the more that you can provide, the merrier our offices will be, because we are looking for pedagogies that are vetted by VDOE to make sure that we are actually practicing what it is that our State Department will request. So thanks for that.
I think, oh, I got you again, Jay. I'm sorry.
You go in.
Thank you. Well, I would echo also what Tawana said. I do think we're seeing some great things at the state level, VDOE, Department of Behavioral Health. Literally, I'm in a room right now because DCJS is here at training about 100 of our staff right now on Pathways to Prevention. And so we are extremely grateful. So dedicated funding to more free training would be awesome. But I also think building, and I guess you don't have to have an act to do this, but lifting up again what Tawana has shared. And I literally was writing down as Jay was talking about literacy. I was like, yes, just we're all doing some phenomenal things. And that sometimes gets lost in the tragedy of the next crisis. And just to be able to lift that up and share it, and to have that equal exchange, even with VDOE, or particularly with VDOE, to help feed what they need and help them to feed us, to keep this work growing. And so I want to give us a huge shout out for what we are each of us doing, that is just tremendous as we get ready to start a new school year. But then also to give shout out to the state, and voices like Kat, that piece on the status of school mental health is just phenomenal. There's an amazing amount of information in there that can really, I've used the word several times, but really propel us to the next level. So I'm excited and grateful for that.
And I just echo what's been said, and also thank you, Kat, for kind of creating the space for the conversation today and ability to kind of lift that up. And I think the more we can learn from colleagues that are doing great things, and the more that can be shared, the more we all benefit from it.
Awesome. Thank you all so much. Yeah, you're doing rock star work out there. I've talked about this to so many people and being like, I just can't wait to share what you've already spoken to me about before we even came on this call. And I learned even more from this call from y'all. So just really grateful. I'm going to open it up to some questions from the audience. You can come off mute or put it in the chat, or actually maybe raise your hand and we'll call on you to ask if you're going to voice it out loud, but also please, if you want to put it in the chat, please do. So we will open that up. If there's no questions, then we did an awesome job sharing. I mean, we'll take it. Great job, y'all.
Can I say something? I just wanted to give a shout out to Kat, because I reached out to Kat just based on the emails that I got, and we just connected. But one thing that Kat did was that she connected me with Henrico County Public Schools with Amy Johnson, because they have this wonderful mental health, whole department. And I am reaching out to divisions that are similar to Chesapeake Public Schools in size and nature to see what efforts are being done. And also just to get the at the table conversations and the conversations that happen away from the table, right? Because we know that there are two different entities that happen when you're trying to move mental health into your building. So Kat, thank you for that, for just connecting me with Amy. We've had some conversations and we have some more to have, but you are a link in this process. So I appreciate you too.
Thanks, Tawana. I appreciate you. Well, I guess we will say that is that. If anyone has any additional questions that come up after the fact, there is a survey in the chat, but also I don't know if these folks, these panelists would like to share their contact information. If you want to reach out to them directly, I'm sure that folks would really appreciate that if you'd be willing to drop those in the chat. But otherwise, thank you all so much for being panelists and being amazing in your school systems, and just for the community at large and our young people. Thank you to all the folks who are here listening in, really appreciative of your time, and also your commitment to young people and being so invested in mental health in Virginia and really getting our system up in such a good way for our young folks. And also I have to thank our sponsor, Anthem, again, for sponsoring this series. This was new, so I'm still getting used to it, but really grateful for the continued support from Anthem and just all you folks who are here. So thank you all again, and I hope you have a great rest of your day.